Well, let's speak now to Dr. Olivier Epaulard, Professor of Infectious Diseases at Grenoble University Hospital. Thanks for joining us on France 24. Let me start by asking you, do you think that mandating a health pass, as Italy and France are doing, is an effective way of encouraging people to get vaccinated?
Yes, I think that we have these very useful tools. Those vaccines are efficient and those vaccines are very safe. First, I think the government thought that the whole population will get vaccinated because it was safe and effective. But finally, a huge part, or not so huge, but maybe one of third people would refuse the vaccine or would be very hesitant. Also, and so they choose this method, which is not a very interesting method, but to do this sanitary pass. They want to make sure that a lot of people get vaccinated. It's not a very elegant method. I understand why it has been taken.
It's practical rather than elegant, perhaps. The World Health Organization, meanwhile, has asked countries like France to delay giving any booster shots until more people in developing countries have received a first dose. What's your view on that?
Our views on that, for the moment, there is no need for a third dose. The need is not to give a third dose to those already vaccinated with 2 doses, but to give to as many people 2 doses, either in Europe or in North America, but elsewhere. We should not keep vaccine to give a third dose to those already vaccinated, but we should convince people without vaccination to get those 2 doses, and we should give doses to all the poor countries, not developed countries, to have these vaccines too. So in my opinion, the World Health Organization is right. We do not need to have a third dose at the moment, even with the Delta variant.
Now, it's been nearly a year and a half since COVID-19 was officially deemed a pandemic. We're still facing new variants, new waves of infection. Do you think that people and perhaps governments too have become too complacent?
It's difficult to answer. What we see is that it is the same disease at 1 year and a half ago. Of course, there have been some variants. Of course, the Delta variant is more contagious, but it is still the same. It is still the same disease that 1 year and a half ago. Maybe that the government did not anticipate the extent to which people would refuse the vaccine. Maybe they have feelings that as soon as the vaccine will become available, everybody would get it. And so it was not necessary maybe at the beginning to make the sanitary pass or to make mandatory vaccination. But now I think that in France or elsewhere, all over the world, if we are doing the same mistake, we will have the same problem. If we do not vaccinate people, we will have the same problem that in Italy 1 year and a half ago, or in France last spring in 2020, or in France or in UK in the spring 2021. I don't know if people are complacent. I think that people are tired. People are tired because it's always the same questions, the same problems, the same discussion regarding the contagiousness or the severity of the disease. But I hope that with the measure taken in France, the sanitary pass or all over Europe, we will get out of this pandemic.
Olivier Epaulard, thanks so much for joining us on France 24 today.